months, Ohio is picking up the pace.
Once the slowest state in the U.S. when it comes to vaccinating for COVID-19, the Buckeye State is rising in the rankings. NBC4 Investigates Jamie Ostroff has been tracking the data as needles go into the arm. So what's changed and what was the holdup?
Well, we could take a look at the numbers here. 2 weeks ago, I told you that Ohio ranked 47th in percentage of state population that has gotten both doses of a COVID vaccine. Well, today we are 36, so the needle is moving, no pun intended. I did ask the governor, Mike DeWine's office, how we have managed to pick up steam, and was told the targeted approach aimed at vaccinating individual groups was working. I also spoke with a local health official, though, who says we still have challenges to overcome if we want to gain any more ground.
If someone could let me know when the car comes through.
The Ohio Expo Center is buzzing with activity. It's where Columbus Public Health is rolling out vaccine doses.
All right, little stick.
In what feels like a choreographed routine.
I pulled in 7 minutes. I got the shot, and I'm out here waiting my 15 minutes.
A good experience, says Larry Thomas. But when you ask him this... So what about scheduling your shot?
That was hard.
At 65, Thomas became eligible for a vaccine Monday. He said it took him weeks to find an appointment after trying over and over again on different providers' websites.
You know how they used to have the radio shows where you call in and you're the ninth caller, you win? I looked at like that.
But he and the hundreds of thousands of other Ohioans who qualify for a vaccine shouldn't have to, says Columbus Public Health Director Dr. Mashika Roberts.
Where we're having some challenges is probably reaching that 65 and older group because there are so many different options for them to get vaccinated that I think they're getting overwhelmed by trying to find a location that has a vaccine for them.
From public health agencies to private pharmacies to hospitals, all with different websites to visit, Roberts says CPH is working on ways to make it easier to find an appointment. And they'll show me how next week. Supply also continues to be an issue.
Next week, we'll get 1,000 doses. It should come Monday or Tuesday.
And is that more than what you were getting, say, 3 weeks ago, 4 weeks ago?
No, it's the same as what we were getting 3 weeks ago before we started doing K through 12.
That push to vaccinate school staff in recent weeks brought a surge of doses to the Columbus area. Columbus Public Health got 14,000 doses last week, but fewer than 5,000 this week. Kroger, another provider, got 15,000 to deliver just to Franklin County educators in 1 week. The grocery chain is now back to getting 100 doses per store per week from the state, plus another 100 from a new federal partnership. Well, there is still that promise of more to come. The state is set to receive 10,000 more doses next week than it did this week. And if anything, that surge of doses that came in over the past couple of weeks to vaccinate all of those school employees did give those providers, Kroger and CPH included, the confidence to know that they can handle that.
Yeah, but you know, when you hear they're getting 100 doses, like 100 doses, I know people who have been on phone, on the line, you can't get an appointment.
Yeah, like Thomas said, it's almost like calling a radio contest.
Yeah. I think he put that perfectly.
Yeah, all right. Keep on top of that, Jamie.
Always.